This video will cover enteropathy-associated T-cell lymphoma. To anchor us, let's first notice the main attraction here, which is the green fast food restaurant named Taco Cell. This restaurant represents T-cells because Taco Cell and T-cell are similar. The fact that it's green will clue us into lymphoma since lymph things are usually represented in green. But this one is an interesting location because it looks like it specializes in sausage. This is to help us remember the enteropathy portion because this lymphoma affects the small bowel. And as in other videos, small bowel is represented by sausage because, well, they just look alike, unfortunately for us. Okay, so now that we've anchored ourselves, let's begin. This is a high-grade T-cell lymphoma that arises in patients with long-standing celiac disease. To represent celiac disease, we have a classic car here. And I'll admit, I wasn't born when these cars were at their prime, but this is a classic Cadillac. Cadillac sounds similar to celiac. One interesting thing to remember additionally here is that this lymphoma is preceded by refractory celiac disease with mucosal ulceration. To represent mucosal ulceration, the seats in the car have tears on them. Not much explanation needed for that one. Maybe this car is giving some important diplomat from Europe a ride because look at the flags on it. The European Union flags will help us remember that this lymphoma primarily affects those of Northern European descent. Another important risk factor is to remember that HLA-DQ2 and HLA-DQ8 are alleles associated with this. Those carrying these are at higher risk. We'll remember this by noticing that there's a daiquiri promo going on here where they're doing 2 daiquiris for $8. If you were to shorten daiquiri, you could write it as DQ, right? And of course, since the 2 for 8, then we can remember DQ2 and DQ8. CD3 is expected to be positive and is represented as in other videos by this tree since the word tree sounds like the number 3. CD30 is also expected to be positive. CD30 is classically the immunostain for classic Hodgkin lymphoma. And since Hodgkin sounds like hedgehog, that's how we'll remember this, since there's a cute little hedgehog on the car. CD4 and CD8 are expected to be negative. To remember negative CD4, just notice that there's actually no door in this restaurant, and the word door sounds similar to the number 4. Okay, now I know what you're thinking. If CD8 is expected to be negative, then why is there a gate in this image? Because gates usually represent CD8 in other videos. Well, okay, I'm going to push us just a bit harder and remember one quick extra neoplasm in this image. Notice that the gate isn't next to the Cadillac, it's actually next to this just random vehicle here. This is because monomorphic epitheliotropic intestinal T-cell lymphoma, which used to be referred to as type 2 enteropathy associated T-cell lymphoma, is expected to be positive for CD8. So that's why there's a gate right next to this car here. Now let's continue to talk quickly about this entity here. Notice the demographic of characters in the car. Exactly, the demographic primarily affected by this neoplasm are Asians and Hispanics. And notice importantly that since again this is not a Cadillac, this neoplasm is not associated with celiac disease. Alright, another thing about this neoplasm is that it's expected to be CD56 positive, which is represented as in other videos by this frisbee made of sticks, because the word frisbee sounds like 50 and the word sticks sounds like the number 6. Okay, last point is that the T-cell receptor is expected to be gamma delta. T-cell receptor is represented by this kiosk, since kiosks are essentially receptors, right? And it's literally showing gamma delta on the screen. Okay, so these were the extra few things to remember about the other neoplasm, which was again monomorphic epitheliotropic intestinal T-cell lymphoma, which used to be referred to as type 2 enteropathy associated T-cell lymphoma.